Case discussion number 2. We will cover deep peroneal nerve, femoral nerve, obturator nerve, lateral femoral cutaneous nerve. Here is a brief flashback of the case. After lifting his girlfriend, a 42-year-old man felt a sudden pain in his low back and a shooting sensation down to her great toe. Given the most likely injured nerve root, which of the following nerves are likely to be affected? A. Femoral nerve. B. Obturator nerve. C. Lateral femoral cutaneous nerve. D. Deep peroneal nerve. The L5 nerve root is among the most commonly affected by disc herniation, and usually causes pain in the L5 dermatomy, including the great toe. Among the nerves listed, the deep peroneal nerve is the only one that derives input from the L5 root, by way of the sciatic nerve. It innervated several muscles, the tibialis anterior, extensor digitorum brevis, extensor digitorum longus, and extensor hallucis longus, which is responsible for foot dorsiflexion and inversion, including extension of the digits. Sensory loss is limited to the skin of the first web space, between the great and the second toes. The femoral nerve receives input from L1 to L4. It innervates the iliopsoas, quadriceps femoris, and sartorius muscles. The iliopsoas is built up from psoas minor muscle, psoas major muscle, and iliacus muscle. Quadriceps femoris is built up from rectus femoris, vastus intermedius, located beneath the rectus femoris, vastus lateralis, and vastus medialis. Lastly, the sartorius muscle. The femoral nerve is responsible for hip flexion and knee extension. Sensory loss limited to the anterior thigh, medial leg, and foot. The obturator nerve receives input from the L2 to L4 roots. It innervates the adductor muscles, including pectineus muscle, adductor longus muscle, adductor brevis muscle, adductor magnus muscle, gracilis muscle, and the external obturator muscle. They all are responsible for the adduction of the thigh. The external obturator muscle also responsible for external rotation of the thigh. It covers the sensory area at the medial thigh. Injury of the obturator nerve usually caused by pelvic surgery. The last in the option is the lateral femoral cutaneous nerve. It is derived from L2 and L3, and only has sensory function over the lateral and anterior thigh. Injury of this nerve, also called neuralgia paresthetica, caused by the entrapment of the nerve under the inguinal ligament. Risk factors including tight clothing, obesity, pregnancy, and pelvic procedures. So, after watching the whole discussion, you must have figured out which one is the answer. Please, comment below. Stay tuned for the next video post. Also, check our YouTube channel. Link in bio. If you love the video, hit that like and subscribe button. Thanks.